Hey, everyone, welcome back to the channel. It's Vlogmas Day 10, and today I've got something special for anyone looking to start or advance their career as an NHS community healthcare support worker. In this video, I'll be walking you through some of the most common interview questions for this role, and I'll also share some tips and strategies on how to answer them confidently. Whether you're new to healthcare or have some experience, these insights will help you prepare and stand out in your interview. Let's jump right in and get you ready for success. 1. Why do you want to work as a community healthcare support worker in the NHS? I want to work as a community healthcare support worker in the NHS because I have a genuine passion for helping others and making a positive impact on people's lives, particularly in a community setting. I believe that supporting individuals in their own homes and helping them maintain their independence is incredibly rewarding. The NHS is known for its commitment to providing high-quality, compassionate care, and I admire the values it upholds, such as respect, dignity, and inclusion. Working in this role would give me the opportunity to contribute to the well-being of patients, while also allowing me to develop professionally in a supportive and diverse healthcare environment. I find it fulfilling to work as part of a team that makes a real difference in the lives of individuals and communities. And I am excited about the opportunity to bring my skills, empathy, and dedication to this role. 2. Can you describe your previous experience in healthcare or a similar field? In my previous experience, I've had the opportunity to work in roles that have honed my skills in providing care and support to individuals. I worked as a care assistant in a residential care setting, where I supported elderly residents with daily activities, personal care, and mobility. This role gave me hands-on experience in ensuring that individuals' needs were met in a compassionate and respectful manner. I also had the chance to collaborate with a multidisciplinary team, including nurses and social workers, to provide the best possible care for the residents. Additionally, I've volunteered with local charities where I helped support individuals with mental health challenges, assisting them with their daily routines and ensuring they had access to the resources they needed. These experiences have taught me the importance of person-centered care, effective communication, and how to adapt to the individual needs of patients. They have also helped me develop strong organizational skills and the ability to prioritize tasks in a busy and demanding environment. I feel these experiences have provided me with a solid foundation for the role of a community healthcare support worker. 3. How do you approach providing person-centered care for patients in the community? When providing person-centered care for patients in the community, I believe it's essential to focus on the individual needs, preferences, and values of each person, ensuring they are treated with dignity and respect. My approach begins by actively listening to the patient, taking the time to understand their unique circumstances and concerns. I would always ensure that they are fully involved in decisions about their care, asking for their input and respecting their choices, whether it's about treatment options or how they prefer to receive care. I also recognize the importance of building a strong relationship based on trust, as this allows patients to feel more comfortable sharing their concerns and cooperating with care plans. I would take the time to explain everything clearly to the patient, making sure they understand the care process and feel confident in the decisions being made. Additionally, I would work closely with family members or carers, if appropriate, to ensure a holistic approach to the patient's care. Overall, my goal is to ensure that each patient feels heard, respected, and empowered throughout their care journey. 4. How would you manage a situation where a patient refuses care or treatment? If a patient refuses care or treatment, I would first approach the situation with empathy and patience. It's important to listen carefully to the patient's concerns and understand the reasons behind their decision. I would reassure them that their feelings and autonomy are respected, and I would try to open a dialogue to address any misunderstandings or fears they may have. It'd provide clear information about the benefits and risks of the treatment, answering any questions they might have in a calm and respectful manner. If appropriate, I would offer alternative options or a compromise, ensuring that the patient feels involved in the decision-making process. Ultimately, I understand that a patient's right to refuse treatment is an important part of their autonomy, so I would respect their decision while documenting the refusal and informing the relevant members of the healthcare team to ensure appropriate follow-up. 5. What strategies would you use to build trust with a patient who is anxious or apprehensive about receiving care? Building trust with a patient who is anxious or apprehensive about receiving care requires patience, empathy, and clear communication. I would start by acknowledging their feelings and providing reassurance. It's important to listen to their concerns without judgment, allowing them to express what's making them feel uneasy. I would make sure to introduce myself in a calm and friendly manner, explaining the purpose of the care I'm providing and what they can expect during the process. Transparency is key, so I would explain each step of the care plan clearly, giving them the opportunity to ask questions and address any fears they may have. I would also ensure that the environment is comfortable and that they feel in control of the situation, offering choices where possible. By demonstrating respect for their preferences and concerns, and being consistent in my approach, I would work to gradually build a trusting and supportive relationship. 6. How do you prioritize your tasks when working with multiple patients with different needs? When working with multiple patients who have different needs, I prioritize tasks by first assessing the urgency and importance of each patient's situation. I begin by identifying any immediate care needs, such as medication administration or urgent personal care, to ensure that the most critical tasks are addressed first. I then consider the level of support each patient requires and ensure I allocate sufficient time for more complex or time-consuming tasks. I use time management tools to stay organized and ensure that I meet all necessary appointments, while also being flexible to adjust my priorities if a situation arises unexpectedly. Throughout, I ensure that I maintain clear communication with the patients and my team, ensuring everyone is aware of the priorities and any changes. This approach helps me manage my workload efficiently, ensuring that all patients receive the care and attention they need in a timely manner. 7. Can you describe a time when you had to handle a difficult or challenging situation with a patient or team member? In a previous role, I was working as a healthcare assistant, and I was assigned to a patient who was very anxious about receiving care. They had a history of being uncomfortable with healthcare professionals due to past experiences, which made it difficult for them to trust new staff members. One day, I needed to assist with personal care, and the patient became quite agitated and refused help. I remained calm and took a compassionate approach, listening to their concerns and acknowledging their feelings. I reassured them that I was there to support them and explained the process step by step, ensuring they felt in control. I also asked them how they would prefer to receive care, which helped build rapport and trust. After a few minutes of conversation, the patient agreed to proceed, and I was able to complete the care with minimal discomfort for them. Later, I discussed the situation with my team leader and shared the approach I used. Together, we identified ways to ensure the patient felt more comfortable with future care, including adjusting how we communicated and providing additional support when needed. This experience taught me the importance of patience, clear communication, and tailoring care to the individual's needs. It also reinforced the value of teamwork in managing challenging situations. 8. How do you ensure that you are following health and safety protocols when working in patients' homes? When working in patients' homes, I ensure that I follow health and safety protocols by first familiarizing myself with the specific guidelines and risk assessments related to the patient's environment. Before visiting, I review any relevant information about the patient's condition and their living situation to identify potential risks, such as mobility issues or environmental hazards. Upon arriving at the patient's home, I always conduct a thorough assessment of the surroundings, ensuring that the space is safe and free from any obstacles that could pose a risk to the patient or myself. I make sure that all equipment I use is in good working condition and that I am trained on how to handle it properly. Additionally, I consistently wear the appropriate personal protective equipment (PPE) as required, ensuring proper hygiene and infection control practices. I make sure to follow the latest NHS guidelines on infection control and any specific protocols related to the patient's condition. I also keep clear and accurate records of any health and safety concerns I encounter, reporting them to my supervisor or relevant authorities when necessary. Communication with the patient and their family is key, so I take the time to ensure they are aware of any safety procedures or precautions that need to be followed in their home environment. By being proactive, thorough, and vigilant, I can ensure that health and safety protocols are consistently followed, ensuring the well-being of both the patient and myself. 9. What do you understand by safeguarding in healthcare, and how would you implement it in your role? Safeguarding in healthcare refers to the protection of vulnerable individuals from harm, abuse, or neglect, ensuring their well-being, rights, and dignity are respected at all times. In the context of community healthcare, it involves identifying signs of potential abuse, neglect, or exploitation and taking appropriate actions to protect the patient. This includes working in accordance with the relevant safeguarding policies and procedures, such as reporting concerns to the designated safeguarding lead or social services when necessary. As a community healthcare support worker, I would implement safeguarding by always being vigilant and observant when interacting with patients, especially those who may be at a higher risk of harm, such as the elderly or those with mental health conditions. I would ensure that I follow the required training on safeguarding, maintain confidentiality where appropriate, and seek guidance from senior staff if I'm unsure about a situation. If I suspected any form of abuse or neglect, I would report it promptly. Ensuring the safety and well-being of the patient is always the priority. My goal would be to provide compassionate, safe care while maintaining the highest standards of professionalism and ethical responsibility. 10. How do you stay up to date with NHS policies and best practices in community healthcare? To stay up to date with NHS policies and best practices in community healthcare, I make it a priority to actively engage with the latest guidance and resources available. I regularly review the NHS website and any updates they provide, as well as relevant professional journals and publications. I also attend training sessions, workshops, and any continuing professional development (CPD) opportunities offered by my employer or external organizations. Networking with colleagues and discussing best practices during team meetings is another valuable way to stay informed. Additionally, I'm proactive about using online platforms, such as e-learning modules, to enhance my knowledge of new policies or changes in practice. This ensures I can deliver the best care to patients while adhering to the latest standards and regulations. Do you have a questions? Yes, I do have a few questions. I would love to know more about the day-to-day responsibilities of a community healthcare support worker in your team, and how the role fits within the wider multidisciplinary team. How do you ensure effective communication and collaboration between team members, especially when managing patients with complex needs? I'm also curious about the support and development opportunities available to staff, particularly when it comes to training and career progression. Lastly, what would success look like in this role, and what are the biggest challenges someone in this position might face? Thank you for giving me the opportunity to ask these questions. And that's it for today's video on NHS Community Healthcare Support Worker Interview Questions and Answers. I hope these tips help you feel more confident as you prepare for your interview. Remember, preparation is key, and with the right mindset, you'll do great. Don't forget to like, subscribe, and hit the notification bell so you never miss an update. Thanks so much for watching, and I'll see you in tomorrow's Vlogmas video. Good luck with your interviews.